Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
Reasons for opting for a C-section delivery, planned and emergency. A caesarean delivery or C-section is a surgical procedure involving making an incision on a woman's abdomen, either along the midline or in a transverse manner. This allows the uterus to open and provides access to the child, allowing him to be delivered. There are certain medical reasons that call for a C-section to ensure the safety of the newborn child and the mother. Causes of a planned caesarean delivery. In a few cases, either the mother or a doctor may decide in advance to proceed ahead with a caesarean delivery instead of a normal vaginal delivery. 1. Multiple babies. If the pregnancy involves twins or triplets, the chances of their cords entangling each other are quite high. In this case, doctors suggest a caesarean delivery. 2. Delayed growth. If a baby grows too slowly within the womb or the development has stopped altogether, then the baby is taken out using a C-section to put him on support. 3. Medical conditions. Caesarean delivery is chosen for mothers to be with pre-existing conditions, such as hypertension or even gestational diabetes. 4. Multiple caesareans. If previous deliveries of a woman have been via C-section, then opting for a vaginal delivery can cause the uterus to rupture and lead to complications. Causes of an emergency C-section birth. 1. Delayed dilation. If the cervix fails to dilate amid normal delivery, then a C-section is executed right away. 2. Pelvic disproportion. Pelvic disproportion, also known as CPD, is where the pelvis is smaller than the baby's head, causing the baby to be stuck in the canal. A C-section is opted. 3. Defects at birth. If the baby's heart rate is low or if his brain is filled with fluids, then a vaginal delivery will not be safe. Hence, an emergency C-section is done. 4. Rupture of the uterus. In the midst of the delivery, if the uterus splits apart, it could suffocate the baby and be fatal. Hence, a caesarean delivery would be suggested right away. 5. Preeclampsia. When the mother's blood pressure shoots up, it deprives the baby of the blood and oxygen required during the delivery. So, a doctor opts for a caesarean. 6. Umbilical problems. The umbilical cord of the baby could enter the cervix before the baby and obstruct the path or even choke the little one. When a doctor suspects this, he will immediately conduct a caesarean. The reasons for elective caesarean section seem to vary from a personal choice to the presence of various medical conditions or history. Irrespective of those, it is best to stick to your doctor's advice and agree to a caesarean if there are chances of complications in the midst of a vaginal delivery.